got a heavy one today.
No.
Yeah. I don't even know if I told you about this yet, but I feel like I should have told you about this, but I may have. So tell me if I have.
Okay.
Today, the podcast is with somebody that knows me very intimately.
Oh, boy. Is it John?
No, it's not.
Is it your mom?
No, it's not.
Okay.
Who in our lives knows us the most intimately?
Your gynecologist?
Yes.
Ooh.
Today, we are speaking to my obstetrician.
Okay.
So this was like, honestly, I don't even know how this came to be. So the twins are 18, right?
Yes.
I have never lost contact with this woman.
Oh, that's nice.
I don't know if it's because I just can't. I don't know if I need, well, for a long time, I would say the reason why I probably stayed in touch with her was because I needed the reassurance that I should not have more kids.
Okay. All right.
So I know like what her purpose was, I would say like, maybe 5 to 8 years post the 20s. And now it's that she's just so unbelievable. And so she's has her own practice and she's not delivering as many babies. I mean, I don't even know if she's delivering any. She's definitely moved into more like perimenopause and, all like older people, hormonal issues, but not older like our moms per se, but like, I would say late 30s to mid 50s is where she is. So she's doing that. And I've been watching her on Instagram. And so I was like, hey, why don't we do a podcast? And I said, I would love the opportunity to really talk about my birthday.
Oh, okay.
And that's exactly what we did. And I didn't think it was going to be, it's not dark, like for the record, like I'm not going to say like disclaimer guys, but I like had a bad delivery.
Yeah, you did
too.
You did. I didn't have a bad delivery per se. It was just a little, well, it was unexpected or it was early. It was a little, the circumstances surrounding my life at the moment were a little crazy. So but the birth itself was not traumatic.
Except when Dan went down.
Except for when Dan was intoxicated and almost passed out.
Yep.
So for me, it wasn't traumatic. For him, it was more traumatic.
Yeah, he doesn't remember. That's it. He was so brain up. It was Super Bowl Sunday, everybody, by the way, when Lauren delivered. So just so we have that in perspective. But yeah, the woman who delivered that we're going to talk to, Dr. Barbieri, I had never met her before.
Oh. Like she wasn't your doctor before this?
No.
She just, that's weird because my twins were not delivered by my doctor.
Really?
They were 8 weeks early and he was in the Bahamas.
Of course he was. Yeah.
But then it was good though, because after the fact, like a month after they were born, he had to retire immediately because he found out he had brain cancer.
Oh my God.
So it was kind of meant to be that he didn't deliver my kids.
That's a little dramatic.
Yeah, he passed away too, like within a few months.
What? So so no bueno for your doctor.
So it was kind of meant to be. It was good that they were early because then somebody else delivered them.
Yeah. Well, I had never met Dr. Barbieri before that day. And it's so interesting because this is the part that you're going to find fascinating. So when we listen to this, to hear the delivery day story from your medical team side,
yeah,
it's really fascinating. So like literally we got to buckle down. Now I will give you a disclosure. I did have a traumatic delivery. I still pretty much carry birth trauma around with me every single day. I don't know if and when I ever will get rid of that, but I don't talk a lot about my delivery in general here at Twiniversity because I don't want to scare anybody. But your takeaway should be that I'm freaking sitting here making jokes with Lauren and talking about everything under the sun. So let that be your takeaway. And here you go. I can't wait for you guys to meet her. Here is Dr. Ana Barbieri. Pause. Okay. So I just found out we pressed stop on that. We came back in. All right. Lauren doesn't even know the name of the doctor.
Nope, I don't. I have no idea. He was a young guy.
You just said you didn't meet it. You didn't know this person.
I never knew him beforehand. So
okay, but please tell them.
He was covering. So he delivered my twins via C-section, but he also gave me a mini tummy tuck, because that was a thing back then, that a lot of the doctors would give you a free mini tummy tuck if they felt, you needed one. So he leans over to me before he starts and he was like, I can tell you're the type of girl, you wear a 2-piece bathing suit, right? And I said, yes. He's like, don't worry, I'm going to take care of you. Wink, wink. And he did. And then Molly screwed it up. I got pregnant with Molly and that went out.
So wait, so when you had Molly, did you have a C-section?
Yes, but totally different doctor.
And so no free mini tummy tuck?
No. But I knew a few other women, friends of mine that had the tummy tuck with other doctors. It was like a thing. They like gave you a little extra nip and tuck, and yeah.
It's too crazy. All
2006,
right. Well,
things that happened in 2006.
We need a whole list of them. All right, guys. All right, back to Dr. Barbieri. Here we go. Gang, this is probably the podcast that I have most been looking forward to since I started our podcast, which I think is a few hundred episodes now. Honestly, I have no idea. I probably should keep better track. But today we are talking to Dr. Ana Barbieri, who I had not met until my own personal delivery day. And I know that there's an acknowledgement to her in my book. I know that as far as my life goes, there's probably a handful of people that I would personally say that I want to make proud. And she is one of them. She's also somebody that I don't think I could say this about anybody. I humbly, in my heart of hearts, believe that I am sitting in this chair talking to you because of this chick. And so without further ado, Dr. Barbieri. Whoa! Hi.
Hi, Nat. Oh my gosh, I'm so happy to be here. It's great to see you. I know other people can't see us, but it's so great to see you. I still remember your delivery. And we'll get into it. And I know that. And I just want to say, like, I am so grateful for my job and my profession, because this is what makes it all worth it. And it makes me cry when you talk about it like that. And I just am very, very lucky to have landed in this field that I really love, and to be a part of these moments. Like it's not a lot of jobs that we get to do that for people. So I'm really honored to be here, and thank you for inviting me. I love it. And I love talking to you anyway. So
yes, well, I haven't let you go. So 18 years my twinnies are, and I have never let you go. You were always top of mind, especially on their birthday. So I think I kind of say, let's maybe jump into that first so people could understand, because I don't think a lot of people really understand why Twiniversity was founded, right? So if you look, you could say, oh, Nat started a business and she just wanted to help twin families, blah, blah, blah. That's what she does. She's from New York. Everybody starts a business. That's not at all what happened. So I had a great job before I started Twiniversity and before I got pregnant. And I think that my pregnancy really just changed the course of my whole life, because I did not have a very typical pregnancy. I did not know that people with twins typically didn't have a typical pregnancy, because I had just only known people that had singletons. So for my whole pregnancy, I was always trying to compare my pregnancy to that of my friends with singleton pregnancies. You weren't my OB for the majority of my pregnancy, right? So I had Dr. Amaro. You were part of a practice. She was wonderful, though. Like literally had no complaints whatsoever. Loved that. I specifically went to a women's practice. And not sure if you know this, but I had went to another practice previous to coming to the one where you were.
I didn't know that.
I did. And I hated him with a passion. And I left his office crying. And my husband said, we're never going back there, because I wanted to deliver at a different hospital that was closer to my house. And it's where I was born. So I went there first. That was like my go-to. And then honestly, I can't remember how I found you. I honestly think it may have been the IVF clinic that kind of referred you guys to me. And when I went up there, I just felt so much more comfortable being at like a female-led practice. So starting there, did you purposely seek out a practice like that? Or like, how did your behind the music of getting there worked? Like when you were in med school, did you say, no, like I want to work with females, or how did that I don't know that story about you.
Yeah, I'm happy to talk about that. And this is the second time this week that I'll talk about it, because I still to this day teach medical students, and they ask me that same question, how did you end up where you are today? And these are, a group of guys, which, oh my gosh, I think they could be my children at this point, these young people who are about to finish their medical education are about to choose fields, right? So it starts with that. So when you are in your last year, you kind of have to decide what you're going to specialize in, or what you're going to do your residency training in, which is really your training post-medical school. So nobody just goes to medical schools and puts out a shingle and starts seeing patients. You have to train in a training program that's called residency. So it's funny how these stories go. When I was a med student, I had this one mentor, and this is an example of how people can inspire us. And I had this one mentor who was this woman. She was a breast oncologist. She specialized in the treatment of women with breast cancer. And I thought I had a girl crush on this person. Like, she was intelligent, empathetic. She had a family. She could apparently do it all. Her patients loved her. And because of her, I thought I'm just going to be a breast oncologist. And then I did my OBGYN rotation. So you go through that and you try out different things. And I was within 48 hours, the signal was clear. I was going to do that, and that was going to be my life. And I just fell in love with it. And I'm still in love with it. This summer is going to mark 20 years. I can't believe that, since I finished residency training. So almost 25 since med school. And I would do it over and over again. And I've had some different incarnations of my professional life. But OBGYN and women's health is something that I would do over and over again. I ended up in the practice because I really liked the idea of being in a practice with other women, of being able to support each other in how we wanted to organize our lives, and sharing some values that did not center just around work, not just around what we wanted to do. Did we want to teach? Did we want to do research? How did we want to be on call? But really, how is our work life going to work with our personal lives, how it was going to fit into everything, what resources we had around us. So I ended up being in that practice for quite some time. I'm not in that practice anymore because things evolve and I developed some other interest and my personal life changed. So I've moved practices since then, but it was definitely an amazing start. And I got to meet people like you through it. So it was great.
Everything happens for a reason. Was there a higher amount of twin deliveries at that practice?
Yeah, so that practice, we were a group practice that was connected to, I don't know, can we name names of hospitals?
Yeah, absolutely.
So it was a practice that was connected to Mount Sinai Hospital, which is one of the major medical centers in New York City. And New York, just like lots of metropolitan areas, on average, it's going to have more twin pregnancies because of a couple of reasons. One is the typical pregnancy age skews higher in these areas. So we're going to have more ladies looking for help in terms of getting pregnant. There is also going to be more fertility practices and fertility help available, and things like older age, IVF, are linked to a higher rate of multiples including twins. And at that particular practice, because we were taking care of not just your kind of lower risk singleton pregnancies, but we were connected directly to our high risk department. And we worked directly with several of the fertility practices. By nature of it, we were taking care of more twin pregnancies. And it was, we had the right support. The practice itself was located right in one of the hospital buildings. If somebody needed to be induced, if somebody needed an extra ultrasound, if somebody needed to be delivered, like it was literally a walk across the hall, which was sort of nice for our patients. It was one-stop shopping. It was kind of nice for us too, frankly, because I didn't have to run across town to deliver a baby.
Yeah. And it was great. And you were connected to the high risk doctor as well. That was right there. So literally I would remember just sitting, seeing you guys, and then popping to see Dr. Stone across the hall. So that was, it was easy for us too. So it was a win-win.
I think for listeners who may be pregnant with twins or considering a pregnancy that may end up with a twin pregnancy, or anybody who may have any sort of a greater level of need for surveillance and testing and screening, that is one of the things to consider, especially if you're a working mom. If somebody told me today that I needed to go to like 2 appointments a week, I don't know how I would do it. Like they got to be together. They got to be convenient. So you really want to get the right care, get it from the right person. I want to go back to that story you just said about that first practice too, because that applies to ladies like all of our doctors, no matter what, pregnant or not, or female or not, that doesn't matter. But we need to demand more, frankly, from the people that take care of us on the medical side. But that's part of having the right help, having the right facility, having the right high risk support, availability of ultrasound, all of that. It just makes your life a whole lot easier.
Yeah. It was important. We talk a lot because, as you know, like I have my Twiniversity classes for expectant families, and we really talk a lot about making sure that you're satisfied with the care that you're receiving. And if you're not satisfied, to basically start looking elsewhere, and that's okay, right? So even before we started taping today, we were talking about how everything has a season. You don't have to stick with the first person that you interviewed because that's the person. Now, maybe you have to stay with them because they're the only game in town. Maybe you live in middle America and there really is only one OB. But if you do have a choice, I always remind people that hospitals really are a service industry. And so we get to choose where we could go if there's the choice that's available. So right here in New York City, we have a lot of choice here. And I knew that it was so bad, Dr. Barbieri, honestly, like that first visit, it was an NYU doctor, and like he was horrendous. And he's not there anymore because like I check, and then honestly, I don't think he's practicing anymore because I always keep tabs on kind of where he was. He wasn't a bad doctor. I'm not going to say that like my delivery would have been horrendous, but I know that the story about my delivery and around my delivery was very important. And I, especially somebody who had been trying to conceive for so many years, I really did want a little bit of extra handholding. And something that you said about your girl crush was empathy. That played such a big role to me. And I wasn't getting it there. And it was like, I was so upset. I could still remember, as much as I remember our delivery, and I do call it our delivery because it is ours, but I remember leaving there and my husband saying, like, what are you doing? Like, you don't have to stay there. And then once I found you guys, it was such a breath of fresh air. And I felt like I said, like I was home, I was comfortable. And Dr. Maru was great. And she was very patient. And not only was she patient, the other women in the practice were patient. So the nurses and the assistants, like everybody that was there, it was such a well-rounded practice. And I think you should not give up trying to seek that during your pregnancy, especially now in hindsight with everything that we've been through and how often that I had to come there. It's important to make sure that you're comfortable. So I love that you also were seeking the same thing. And that's probably why everybody's so comfortable. Because if the doctors are doing the same as the patients are trying, it's going to be a win-win.
Yeah. And I think, I'm going to put my patient advocacy hat on here because I'm really like into this topic. And again, I think that applies whether you're pregnant, particularly when you're pregnant, though, because that's a relationship you're starting with somebody. You're going to be putting your trust in someone. That person will be part of one of the most important days of your life. And there is a lot of uncertainty. And I guess we're going to get into that too when it comes to that. But I think it's just, we really need to be able to connect with our providers, doctors, people that take care of us on this human level. And that has to remain part of medicine. And sadly, often it's not. I mean, these days I hear stories from my patients all the time. Women who are dismissed, women who are ignored, women who are told that it's just their hormones making them crazy. I mean, like, come on, like we got to do away with that. When you apply, things go right when you apply medical knowledge and skill on top of that human to human relationship. And that's when things really work. And I think for all of us as patients, right, because we're all patients, including myself, there are some things we can do to learn how to get more out of the system. And the system needs fixing. That's like, we could talk about that for ages.
It's the truth. That's really the truth. But it's keeping that human element to medicine that is sometimes just totally neglected.
And you have choices. Like most of the time, there is some choice in terms of the provider or doctor you see. Some places there's going to be more choices about facilities. And by the way, the hospitals are getting on with it. It's like they are really realizing, they now care about patient reviews and all of that. But even if you don't have much of a choice, you can do certain things on your own to sort of navigate that relationship a little bit. So don't be afraid to demand and ask for certain things. And I will tell you, I mean, again, we're all patients. Recently, I had experience with my own mom who was having, a major surgery, and we encountered a lot of those same issues. So hear what I'm talking about. If you're presented with advice or suggestion or recommendation, ask for the reason for that. Ask about alternatives. Ask about risks and benefits. Ask about what the next step is going to be. What if I don't do this? What if I do this? What do we do next? That should be a part of literally every single medical discussion there is. Surgery, medication, hormones, type of delivery that you're going to have, induction date, all those 4 things, whatever. Why am I doing it? What are the reasons, risks and benefits, alternatives? What's the next step? And sometimes, sadly, in a 6-minute medical visit, we don't get that. And that should be covered all the time.
Oh, I'm so mad that you're not delivering babies anymore. That's it. Now I'm angry. But that's it. It's official. But see, it's funny because you're here on kind of this side of the patient fence, right? And so sometimes I think when doctors first start out, they're so worried about the kind of minutia of making sure things are right, which of course you have to. But I think sometimes when you get a younger doc, that they're more worried about the book stuff versus the personal stuff. And I think the personal stuff is equally, if not more important than the book stuff.
I think, but it's, even a younger doctor, I mean, they've been around for 25 years, on this planet. That's the human stuff has to be part of it from the beginning. And yes, we got plenty of boxes to check and guidelines to follow, and they exist for a reason. But you as the patient, you don't know what those guidelines say. You don't know what boxes are getting checked. You have every right to understand why something is being recommended to you, why someone may want to open up your belly to deliver your twins versus do a vaginal delivery, why you need to be induced at 37 weeks as opposed to waiting for labor. I think we need to move past this, because I told you so type of medicine, because that's how it's done. And I want this message to be super loud and clear, not just for pregnancy, not just for OB, but really for for things that, anything that has to come with, has to deal with our medical care.
That's such like a good point. The I told you so medicine is really still what a lot of people are experiencing, unfortunately.
Yes.
And it's great that basically you're going to shout that message to the younger students that you're teaching. So like for the people in the back, you got to let them know, right? I'm going to do things on my end to, in my classes, be like, okay. So I often talk to my partners about it and making sure that they know that their partner has these choices and that you can ask these questions. Because I know that in our delivery, in all sincerity, I was too scared to ask anything. And even though I trusted you and I trusted the process and I trusted the practice, I was still panicked beyond compare. So let's dig into that for a second, right? So it's such a rare opportunity that I think anybody gets to talk about their delivery in hindsight with a doctor that actually remembers their delivery. And like your words to me, and I don't even know if you remember what your words to me were, but after everything was said and done, and we'll talk about the actual delivery in a second, but I remember when I was finally in a room before I saw the babies that were still in the NICU, you came to the room and I was all by myself. And I remember I was like sweating profusely and trying to I had so much fluid in me from both my preeclampsia and everything else that you guys were giving me. Thank God, because I was finally on the mend enough to be in a room and out of kind of the recovery room. And I remember you sat down on the bed and the light was coming in. Like I honestly, Dr. Barbieri, I could see it. Like I could even tell you like what color the walls were, but we had like the blinds open and they were real blinds. And it was a snowy day in the winter and the light was coming in and it was like that bright winter sun. And I was all by myself and there were no lights on in the room. And there was the only light from the blinds. And you sat on my bed and I said, okay, like what's going to happen next? And you said, I really think that you may want that to be your last pregnancy. You weren't mean about it by any means. And you literally said, I will remember that delivery for as long as I'm alive. And so, of course, I think you're blowing smoke up my butt, right? Because like you're like a fancy doctor and you'll see a million deliveries and like, why would my delivery be special? But you still remember it, which is bad and good, I suppose, right? And I do know that the way that the delivery of people with Leiden factor has changed. So I do know that. I have been like keeping tabs on that. And that was a big issue with my personal delivery. But when you have to tell patients that, like, how do you determine, like, what's the level of severity that you have to go and say, like, okay, you're okay now, but like, that was something. How do you deal with that?
It's not easy, Nat, and I'll tell you what I remember about your delivery, because that was, I mean, our kids are a bit older. Yeah. Right, yes.
Honestly, it was almost 20 years ago.
That was a while back. So I was, I had a lot of experience by then because of my training and because of the sheer number of pregnant ladies that we were taking care of and the babies we were delivering. But it was early on in my, I would say my experience of sharing news and recommendations with people in a way that would result in understanding and trust, right? Like, I mean, these days I got some gray hair, like I'm, like this person, like I've been there, done that. Okay. I remember like in those days, especially if we had to change direction quickly, or, here I am, we don't know each other so well. I got to tell you, you now need this much more urgent delivery. You've got to give your consent. This is medically right. I don't want to scare you. I care about that. I want to give you the facts, but I also need to present it in a way that will feel secure for you. And it's it's stressful. I can't say that it's not. It's a lot because you realize and you can see, and I know I'm one of these people that where I can tell kind of what your emotional state is. So I can imagine myself in that. So I fully understand. And by then, I think I had my first daughter by then. So I had been on the other side too, which helped with my understanding of these things. But I can see like that's a highly stressful event, a lot of uncertainty. You're first faced with this news, like, like you hear these stories. Now things are not exactly going the way that they were, maybe you anticipated them to go. You've got to make these decisions yourself. We kind of like tell you what we advise you to do, but it's still your decision. People get when we get super stressed out, when things start to happen, like a lot of the times our mind is out to, kind of leaves your body. So it's a lot. It's a highly charged moment. And then everything happens, right? So you have your delivery and the twins are born. And that delivery for you was, let's just say it was memorable.
It's like Friday the 13th is what I have described it as. And I remember that having no experience of what a vaginal delivery would be like, I had no expectations. Right. So for those of you that are listening, just know that I ended up delivering at 34 weeks on the day. I was in the hospital for about a week previous to that. I had started showing signs of preeclampsia, but I had been in and out of the hospital starting at 27 weeks. So at 27 weeks was like my first time that I went in, just kept for a day, but it was really touch and go for the majority of my pregnancy. And when we have families that are like, oh, my pregnancy is so like great, it makes me so overjoyed because I know the pregnancy that I had, which is like a big reason of why I want people to feel empowered by decision making. And not that I feel that the decisions I made were bad by any means, but I do feel that you guys were really, really good at explaining everything that happened, including having like the doctors come in from the NICU to talk to me before we actually started, because you induced me. And so you broke my water. Everybody was head down. I didn't even expect to have a vaginal delivery, for the record, because I remember the first time that I went to the man doctor's like, oh, the odds are you'll have a C-section. And then I like to do that boy voice. But you guys were like, let's play it by ear. Like, don't jump to conclusion. Let's see what's going to happen. And I loved that. I thought that I was like, okay, we'll see what's going to happen. But I still had the 34-week mark on my calendar as like, okay, we just got to make it to here. And so midnight before that day, the 34th day, you induced me and you broke my water. And I was already having a lot of issues with preeclampsia. I remember that I was in the tiny labor and delivery room. You guys were giving me morphine. I was in like a severe amount of pain still to this day. I hope to God that that's the worst that I ever feel, which is bad when you have like a baseline of the worst that you could feel. But I remember that once Anna was like coming out, nobody was believing me though. And I was trying to tell the doctors, like I was like, guys, somebody's coming out. And they're like, oh, you're a new mom. It's learning delivery. I'm like, don't worry about it. And I'm like, no. They're like, it's been 5 hours. I'm like, absolutely not. Like, I'm going to shoot babies right out, slip and slide style. It was going to happen right there. And you came in and you're like, very calm. And you're like, okay, let's go. And it was just very like, all right, here we go. La, la, la. Everything's good. And then we go in and then Anna pretty much just slipped out. Like she was coming out in the hallway. Like,
that first one slides out, especially at 34 weeks, they slide out right out. Yeah.
That was it. And I remember you said still, it's even in the book that you said, here comes your fiery redhead.
Oh.
And I was like, what are you talking about? Right. Because look at me. And even John wasn't even like a ginger. So I'm like, it's the morphine. I'm super high. Like, what the hell is she talking about? And sure as poop, there was my freaking fiery redhead. And just like you see on Baby Story, you put her on my chest and like everything was going wonderful. And I'm like, oh, this isn't so bad. We could do this. And you're like, hold, like, don't do anything.
Wait, right? One more to go.
That's it. But you were so good at like, don't push yet. You were so gentle and you were really making sure, honestly, I have to say in hindsight, you were really in such great control of that room because I knew that you were. I didn't know what you were doing, but I knew that everybody had their eyes on you and you were like the orchestra maestro of this symphony that was being created. I had no idea really what was happening. Now, did you know what was happening? And you were just like, okay, I don't want to say anything until, like, did you know a lot more than I did?
Well, in those moments, right? So as an OB, as a doctor, like you rely on your training and your experience, you know what to anticipate and you know what red flags you're looking for. And you know when you're going to hit that things are not going right button. But you also need to remain calm because when you're not calm, the rest of the team is not calm. The patient is not calm. So no matter what, OB is one of these specialties that fortunately most of the time things go right. Yeah. But some of the time things don't, and things can get very, very heated very quickly and bad things can happen. Mm-hmm. Shoulder dystocia, hemorrhage, seizure, surgical injury, all of that. And you need to be able to have enough knowledge to know what to do next. And you need to be able to stay calm yourself in order to help people make those decisions and direct your team to what they need to do, because a successful outcome really depends on that. OB is not for people who easily lose their head. Like it's got to be calm.
You were great, honestly. And I remember too, like after Johnny was born, I remember that I looked at you because John was white as a ghost. And I was able to rook my sister to get into the delivery room too. And so I remember that everybody had a look on their face, including the anesthesiologist, like everybody had this look of, and I'm like, hello. So I said to you, I remember I looked down and I said, should I worry? And you said, I'll tell you when to worry.
Yeah.
And then I just literally leaned back and I said, okay.
And I think part of it, Nat, also it's like, it's the day your children are born. Okay. I also, as a doctor, my first job is to make sure that things go as safely as they can. And I do the right thing for you. But part of my job is also making this day a really special day for you. It's going to be one of the most memorable days of your life. And, over the years, I've seen my share of women who really suffer trauma with their deliveries, who remember the terrible things that happened, who remember that their babies were taken away from them. So as much as we can, that experience needs to be a human experience too. And we got to weigh that and combine that with really keeping our heads about ourselves and really doing things properly and fast when things develop. So yeah, there are things that can happen. And there are women whose deliveries are so complicated, traumatic, bloody, that put them at such high risk of even greater complications in the future, that now we've got to talk about that. We've got to talk about, now your babies are born. Now you've been through this. You need to heal and recover from this. And before you think about another time down the road, let's see what that time would mean for you. And I'm not here to say, there are people who should not be pregnant again or who should not deliver again. I don't mean it's not coming from that angle. Like that is somebody's personal choice. But I do think that when we go through these experiences, we give birth to our children, we should be heading into the next chapter knowing what to expect or what the risks are. Mm-hmm. So I have no problem, especially if I now know you, we have a relationship. I seen this before, like you should know this. Like you should really get information that you can use to weigh your decision for the future. Because guess what? You got to be around for these 2 little babies for a long time. And, kids need us forever.
Well, you did it. You didn't, it wasn't scary.
Yeah.
You didn't scare me. It was just disappointing because, right, I wanted like this giant herd of a family. And I always had envisioned having, like, I know it sounds crazy, especially for New York City, but I wanted like 6 kids. Like I wanted like a pretty insane amount of kids for living on the Lower East Side of New York City. And I had always dreamed of that. And then, of course, like you find out that Mother Nature's not playing ball with you. So you can't conceive the good old fashioned way. So then you had that against you. Right. And then I had this whole issue that I delivered early. So then my body isn't cooperating. And then I have, the advice of somebody in such like, it was a very sincere moment. It wasn't, you didn't overreact. I never felt like, I didn't dismiss it for a second, because I think we all knew in that room that something happened. And we could be like vague about it, but I don't know. Like I am telling you, and you know that I think that I'm alive because of you. And I think you think I'm alive because of you. Like there's definitely going to be cases of patients that that their life is in your hands and you take it as seriously as possible. And you're so skilled that I really didn't panic when in another delivery situation, everybody could have been panicking.
See, what I vividly remember from your delivery is I don't remember the fiery red comment as much as my thought. And I just want everybody to know we agreed that we could share these.
Yes, this is literally will be a disclaimer.
I don't want to put that disclaimer out there. Okay. I remember when you were in labor and you were getting your blood checked like every 6 hours because of preeclampsia, because of platelets, because of liver function tests. And we had already made the decision to induce you and your labs were getting worse. And it came to the point where you see them and you go as an OB, you go, this person needs to deliver like right now. Or else I'm going to have to go in there and I'm going to tell you need a stat C-section. And that's going to be another thing. And that's not that will put you at higher risk of bleeding. So this needs to happen right now. And how do you translate that to somebody in a way that doesn't freak them out, that doesn't make them scared, and that sets you up for sort of a more urgent trajectory that doesn't feel like I'm taking something away from you. That's a very delicate situation. So I really remember looking at that. And I remember going like, Nat better deliver. She better deliver soon. Like we got to do it now or things can happen. And, preeclampsia is one of those things because your audience doesn't know, it's a relatively common condition, more common in women who have twin pregnancies or multiples, more common in women who have a genetic predisposition to certain blood clotting disorders, more common in women who may be older or much younger, who may be hypertensive, have some cardiovascular issues. And preeclampsia can be tied to, all sorts of things, stroke risk, seizure risk, bleeding, organ damage. It can turn into something called HELP syndrome. That's one of the extreme ends of that. So it's really no joke, and I think we hear a lot in the media, these stories about, how my OB took away my experience from me. They just wanted to do a C-section or they just wanted to get me induced so they could go home. Like, no, like the reality is lots of OBs struggle with having to put you through or having to sort of manage an experience that is different from what you're expecting. And it doesn't come lightly. It never came lightly to this OB, It helps also when you have a relationship with somebody. So that's when this like human piece and trust comes into place rather than hearing from somebody you've never met. right? So
it's so interesting because like you remember the before, right? I actually have, I'm not going to say wonderful memories of the before, but I don't have any trauma previous to the delivery. I don't think that that's where it picked up. I think really where it picked up, where I'm still this many years later, which I didn't know that I should have been attempting to heal a lot sooner emotionally from it. And I didn't, because I really didn't talk about it for a long time. And weirdly, I still actually don't talk about it a lot at Twiniversity, but I know the after, and it was the guilt that I had that my body failed. And that immediately made me a bad mom, because I couldn't even get them to where they needed to be. How am I possibly going to raise them? And how am I possibly going to do anything that a mom would do because I already failed? That's where like mine kind of picked up. So like seeing it from your side, I know, and I still have chills weirdly. Like it's so, I don't want to say it's dumb to feel this way, because I know that I'm justified in the way that I feel, blah, blah, blah. But it's so interesting that like still to this day, even after speaking to my kids and like having a conversation that this is what I felt. And they're like, are you out of your mind? You're the best mom in the whole wide world. And like, I can't even understand what's happening. But I knew that like I couldn't see them for a while after delivery, right? So I was in recovery for a while. And was I in recovery because you were waiting for my blood pressure to come down? Was I still bleeding? I don't actually remember why I was there so long.
You were in recovery because you were getting something called magnesium sulfate IV drip, and we do that to prevent seizures in women with preeclampsia after their deliveries. And the highest risk of that is really in the first 24 hours, and that's a drip where you need to be watched. Mm-hmm. Plus, when your blood pressure is really high, when you have lab work abnormalities, things can go even more south. Like things don't really start to get better for a day or two after. So that's a very delicate time where you have to watch people's, urine output and kidney function and liver function and all of that. But it comes at this price, right, of you being separate from the babies. And by the way, things even since that time have improved in that department a lot too. So now we have, as long as the babies are fine, they can come down from the NICU to visit with you in the recovery room. And sometimes, depending on the complexity of someone's situation, sometimes we can do magnesium also in a different room that's a little bit more private and conducive to bonding, right? But I think what you're talking about, it's such I think, we should talk about it more as women. Like, I think that's true in a way for most of us. Like I had a singleton delivery. And then my second delivery was complicated by a shoulder dystocia of my second daughter. So her head came out, but her shoulders did not. Well, that was a whole other story. But I have very similar feelings to you as a mother. They may not center around my delivery specifically, but at the bottom, they're all the same. Every single thing that happens to these girls, and I mean, they are 15 and 19, they've had their share of issues. Somehow in my heart, it all comes back to me. It's my fault. It's my fault because with my first daughter, I struggled so much. Like I thought I was so inadequate as a young mom. And here I was, this OB that had delivered like hundreds, if not thousands of babies before. And I couldn't freaking get the 7-pound thing to stop crying and soothe her. So it was all my fault. And then, I didn't love breastfeeding. So it was all my fault that she got an ear infection. And then it was all my fault that she couldn't, jump up and down on the monkey bars with the other kids. And then it was all my fault that she had anxiety, like all of this stuff, it all comes back to us. So I think we kind of share that. Mm-hmm. But again, for people who sustained any sort of unusual events in labor and delivery, now for medical teams, when that happens, we go through something called debriefing, right? So that's when we all get together and we go over what happened, what went right, what went wrong, how do people feel about it? How do we recover and move on so we can do better next time? And there is some addressing of stress and feelings around it too.
Yeah.
How come we don't do that for new moms that went through it? How about we start doing debriefing for that? You know, why do you have to suffer for years with these feelings over something that, you know, like you were not controlling your blood pressure? You can't do that. That's no fault of your own. We can only, as you know, as mothers, we can only do our best. Like that's, and there are some things out of our control. Like, why don't we debrief people over that and help you heal that way? I feel like that's the job of an OB also. It's not just knowing how to physically deliver a baby or two. It's a lot about that too.
It's very different now. It's very different now. And I think that also, as far as like looking for markers of postpartum depression or any type of mood disorder, it's very different now than when I delivered, because since I went right to the NICU, there were less eyes on me in a pediatrician's office, right? Because Anna was in there for a month. So now I know that when you go for that first baby checkup that, you know, they're going to look for markers of any type of mood disorders. So that's really, really great. But I was kind of exempt from that, even if they did it then, because I was in the NICU. But like, even honestly, after delivery, like, I don't know if like, you know this, I really thought I was going to die. And so like, I remember that I had the priest from the hospital like come to me and go to the babies. And I know that, you know, like I didn't name the twins because I was like, I don't know if I'm going to ever get downstairs to see them. So I want to know who I'm looking for in the next life, you know, and her name does have something to do with you. Like, that's not like, I hope you know that was a factor in that my daughter is Anna, right? So my sister was like, she's an Anna. And she's like, she doesn't look like Nanny, but she's like, Dr. Barbieri, like all this was meant to be.
Oh, Nat, you're going to make me cry. I'm going to make me cry, but I'm going to cry after we're done here.
Okay. I'm going to cry too after we're done here, because come on, who gets this chance to say, like, I love you so much. And I do, like, honestly, and no matter what happened in your life, no matter how bad of a day that you could ever possibly have, I only get to have good days because of you.
Oh, Nat, I love you too.
See, and like, truthfully, and I don't think that there is anything you could have done different. I think even handling what had happened. And so, by the way, guys, I did have a postpartum hemorrhage that then was because of the stupid blood thinners that we couldn't reverse, because it's like, it was literally like this game of like ping pong. And I knew what the doctors were playing. And you were very descriptive about what was happening. And you did explain the risks. Obviously, we're always going to hope for the best. But like, I remember that there was bleeding. And I remember that like somebody said to you, like, do we need blood? And you're like, not yet. And like, you were just like, let's see, like you were so proactive, but yet you weren't like oblivious to the next steps. And I appreciated that. I remember that when I got a recovery too, that they were still worried too about the postpartum bleeding, because they were like checking every few minutes. And I remember I wasn't even wearing a pad. It was Chucks. Like, I was just going through Chucks like nobody's business. There was no like, oh, let's put on these maternity underwear. Like I see, like, you know, all these on Instagram. I didn't even get that. This was like, don't bother. We're just going to have these 6 Chucks underneath you. And we're just going to keep.
Honestly, that's why when my patients come in to see me, I'm like, oh, I'm having my period. Is it okay? I'm like, listen, I've seen blood. Yeah. That's nothing. No, that's postpartum hemorrhage is a real deal. I mean, it's and another topic for another day, but it's still something that kills women, and we got to do better about that. I do think, Nat, now, like from my vantage point of 20 years later, I think that we should have done more for you for that postpartum healing recovery. I do. I don't think you knew.
because I also wasn't vocal about it.
Yeah,
so on the flip side, if I don't say, right, it's like we always say we have to advocate for ourselves. I didn't say to anybody that this is the way that I was feeling. The only person I told was my sister. So I didn't tell a nurse, I didn't tell a doctor. So it would have been difficult for you to even have had the chance to do anything, because I thought I needed to put on this brave face.
Yeah.
Like I have to like, okay, like we've been through it, right? Because you also have your whole family and even the nurses saying like, you did great. And like, ultimately everything is good.
You don't want to disappoint people, right? Yeah. I mean, think about how sort of crazy that is. We go through this major event and then we can't even say the truth for fear that, other people won't be we don't want to disappoint them and take away their impression of how brave we were, when in reality, like we were pretty scared, The other thing, and, I think what's changed for me in medicine, in my trajectory, I think, in those early days, I think we were taught like there is a professional boundary. You got to uphold that. You can't, you're not your patient's friend. Like you have to keep up this sort of, it's a healthy boundary. You can't share anything about your personal life. You can do that. And you know what? 20 years later, I practice differently. I share with my patients some stuff of my personal life. If that's going to help someone understand what they're going through, make them better, help heal them, and create this human connection. So screw that. Like we're all in it together. So now I learn from my patients all the time, and they can learn some stuff about me too, without always making it about me,
always like that, because you always shared pictures of your daughter and stuff. And I remember like thinking like, okay, I just got to get there. Like when I saw, like, I'm like, okay, I could do this. Like you did this, we did this together. I'm going to do this. And so like when I started this whole thing of us talking today, I said, like, I always want to make you proud, because I don't think that I have squandered one opportunity to either live well or help people or pass it on. Like I really, and I know it's horrible to say, but I'm putting this on record, like God forbid something happened to me today and I got hit by a bus. Of course it's going to be horrible, but I really lived. Like after that experience, there's still to this day, nothing that I would not do to help another mom. Like it's impossible. Because, and I don't know, and we talk about boundaries all the time in therapy, and I'm like, I don't know, because I'm from that same school. Like, it's kind of a wiggly. It needs to be a wiggly boundary. It can't be kind of like a hard line, which I think some guys.
I need to borrow that term sometime. A wiggly boundary.
Yeah, it's a wiggly boundary. It's like wiggly schedules when people are like, let's talk about breastfeeding. It's just got to be a little wiggly. It's
I love that. I love that.
We just be chill. But I try to kind of give my people what I got from you. And it's a little matter of fact. It's not delivered with harshness. It's delivered with an immense amount of love and compassion. And you did that for me. And it's funny because even if I wanted to have more kids, like let's say hypothetically, I was like, okay, for Dr. Barbieri, let's just ignore everything she says. Anytime I would even bring it up, John is like, I'm going to leave. Like and my sister's like, there's no way there's no way that you're having another child, because they of course saw it from a different vantage point than I did. Right. So I was kind of like this first person user where they really saw what was going on and, where your arms were, and it really worked out. So I try to have really, to this point, and starting Twiniversity was a lot of that, because since I couldn't have more kids, I remember that saying, well, what do I do with all of this now? Right. I learned everything the hard way. I had a really interesting pregnancy. I had a really interesting delivery. I had a very, very bizarre first year. I never want to say bad, because it is what it is, but it just kept being interesting until they were about 8. And so you say, what the hell are you going to do with that? All the experience that you learn as a mom, you give to your second child. Yeah. So if I knew that it wasn't recommended that I have a second child, this is what I do with it. So I now have hundreds of thousands of babies, and I could reach people, forget about people that I could actually touch, but we reach people in countries that I can't even pronounce the names of.
I think that's amazing. Look,
look what you did though. That's you though. You see that it's a direct connection, that if I didn't get from you what you gave to me, I would never have been able to give to them what they have.
And I think that's, we can be mothers in lots of different ways, including giving birth to this idea and business and education and a whole platform and a community, right? And I want to tell you, like, you've said so many wonderful things about me that I'm going to give you some right back. Like, I want you to know that you've kind of been an inspiration to me. I mean, you know that I've had some different incarnations in my professional life, and I, now run my own practice, and I've had my own fears and doubts about that. And I don't know if you remember, we spoke a few years back about some of this, and we were going through some things, and I really took that to heart. And I'm like, you know what? Like, look what Nat did. Like, I think maybe there is something to it. Like, look at this freaking impressive, accomplished person who, because of this experience, is doing these great things. So I want you to say that you've certainly been a part of my journey, just as much.
I'll take it. Listen, there's no way it could ever be a fair exchange. It can't be equal. We'll say fair. That's what I say. It can never be equal, but we'll say it's fair. But still, to from my last breath, I will thank everything to you, because I even and honestly, I could even say I could be mad about IVF. Probably I wouldn't have had twins if it wasn't, some kind of assisted reproductive technology. So everything happens for a reason. And I can't help, I can't keep helping that, what's going to be, what's the next thing that's going to happen, right? So we're now in this new stage of life, and we could either say, that's it, I'm throwing in the towel, I'm done, like the dealers at Atlantic City, tap your hands and you're done. But you're going into the next evolution, and you're helping you're helping me now. And so that's I reached out to you the other day because I had a whole argument with somebody, and I'm like, oh my God, this is definitely perimenopause. I'm just done. I'm done with everybody. And I love that now the patients that you've had could now still grow with you. So, yeah. And so John told me I had to talk to you anyway about that, because he's like, just like he saw everything the first time around with the postpartum. He's like, you're going to talk to her about that today. So, so now what are you doing? So now you're out of baby land, and you're working with menopausal and perimenopausal mamas and women and everywhere in between.
I really, so I stopped delivering babies a couple of years ago. So I think I delivered about, 2,500, something like that. That's a lot. I'm good. I'm good with that number. But I'm really, really fascinated about this sort of crossover between our hormonal health and gynecologic health, and how it really affects us holistically and throughout our bodies. So I really spend my time really working with women who maybe recently delivered but are not pregnant anymore. Lots of ladies in perimenopause and menopause, working with hormone therapy, really delivering and really trying to deliver more integrative and holistic care. So I'm also I've always been a little bit of a hippie in my heart. So, I do quite a bit of nutritional advice, hormone therapy. I do, study different even supplements, and there's a whole world out there, and some of them are not worth anything, or just big marketing schemes, but some of them can be really helpful too. I teach, and I'm actually part of Nat, you're a big part of that. I'm also part of a company called Electra Health, where we're trying to bring menopause education at scale. And you recorded that message for one of the team members of that, which I was so touched by, who was having her twins, not recently. in the last year. So so it's a big evolution, and
that's great.
It's like my new baby, and we keep going.
Well, we are going to put all the links below of how people could stalk you for more information. And then you have your Instagram channel, which honestly, I really thought was great, of just what you wrote the other day. I was literally in a taxi coming home from the airport, and I didn't even have the sound on, which I love that you had everything written below. And I'm like, oh, she gets me. So no matter where I am in what portion of my life, you've always understood me. But still to this day, I mean, I trust you more than the majority of my family members. Like, there's nothing that I wouldn't do for you. And I'm so thankful that you even agreed to do this. And we've been threatening to do this for a while now. And I'm really glad that you're here. And I really wanted kind of this documented as part of my legacy here on the interwebs and in Twiniversity. Like, I really wanted to make sure that you were a pillar. You are my cornerstone of Twiniversity. Your name would be on it.
Oh, Nat, thank you so much. I really appreciate it.
It's my pleasure. All right. You stay right there. For the rest of you that are listening, all the show notes are below that you need to find Dr. Barbieri. She's absolutely wonderful. I'm sorry she's not going to be able to deliver you guys, but you never know. I would always say, like, you never know what's going to happen next. We all take different turns. She may get tired of not delivering babies. She may miss that new baby smell. Who knows what's going to happen, but it's there. You could follow her adventures as well. And if there's anything else that you need from me or anybody in the Twiniversity team, don't hesitate to ever email us at community@twiniversity.com. Make sure that you like and subscribe, blah, 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 that algorithms. I hate all that junk, but you know what to do. And don't forget, you could send us a direct message on any social platform. We're just at Twiniversity every place. So as the kids say, slide into our DMs. We welcome it. And until next time, guys, see you later, alligators. Thanks for listening.